Hi, my name is Kathy Henry, and today I'm going to be talking about the disorder Propionic acidemia, also known as PA or PROP for short. Propionic acidemia is an inherited autosomal recessive disorder in which the body is unable to process certain parts of proteins, lipids, and cholesterol. It's an organic acid disorder, which leads to abnormal buildup of organic acids. The abnormal levels of these acids in the blood, acidemia, urine, aciduria, and tissues can be toxic and can cause serious health problems. Organic acid disorders are a group of rare inherited conditions. They are caused by enzymes that do not work properly. A number of the enzymes are needed to process protein from the food we eat for use by the body. Problems with one or more of these enzymes can cause an organic acid disorder. This causes harmful substances to build up in their blood and urine, which can affect the health, growth, and learning. The symptoms and treatment vary between different organic acid disorders. They can also vary from person to person with the same organic acid disorder. In most cases, the features of propionic acidemia become apparent within a few days, known as neonatal onset propionic acidemia. It can also appear later on in life, known as late onset propionic acidemia, which will be discussed later on.
Hi, I'm Samantha, and I'll be telling you about the etiology of propionic acidemia. The metabolism of amino acids isoleucine, valine, threonine, and methionine, as well as cholesterol and odd carbon fatty acids, produce propionyl-CoA, which gets broken down by propionyl-CoA carboxylase. In propionic acidemia, mutations in the PCCA and PCCB genes lead to a deficiency of this enzyme. Without propionyl-CoA carboxylase, propionyl-CoA accumulates in the blood, raising the blood pH and interrupting the formation of intermediates in the Krebs cycle, which is essential for energy production. Buildup of propionyl-CoA in the blood can also be toxic and harm the brain and nervous system. When looking at prevalence, it affects 1 in 100,000 people in the United States. It's most common in populations of Inuit, Greenland, Amish communities, and Saudi Arabians. All states currently perform newborn screenings for this disorder.
Hi, my name is Sarah, and I'm going to be talking about the signs and symptoms and how it is diagnosed. Neonatal onset PA is the most frequently recognized form of PA and manifests in the neonatal period as either an abnormal newborn screening or acute clinical deterioration of unexplained origin in which an infant who appeared healthy at birth develops non-specific symptoms including vomiting, refusal to feed, and hypotonia in the first few days of life, which then progress to weight loss, abnormal posture, and movements. If untreated, encephalopathy, severe brain damage, coma, lethargy, seizures, and cardiorespiratory failure can occur, as well as death if not promptly treated. Less commonly, the signs and symptoms of propionic acidemia appear during childhood and may come and go over time. This is known as late onset PA. Some affected children experience intellectual disability or delayed development. In children with this later onset form of the condition, episodes of more serious health problems, which can include developmental regression, chronic vomiting, protein intolerance, failure to thrive, hypotonia, and movement disorders occur. These children can have acute decompensation that resembles the neonatal presentation and is precipitated by a catabolic stress such as infection, injury, or surgery. Genetic testing for PA can be done as a blood sample. This looks for changes in the pair of genes that causes PA. Special tests on blood, urine, or skin samples can be done to confirm PA. PA can also be found through an enzyme test using cells from the fetus. Parents may either choose to have testing during pregnancy or wait until birth to have the baby tested. A genetic counselor can be talked to. Babies who have prompt and ongoing treatment before they have a metabolic crisis may have normal growth and development. Even with treatment though, some children have lifelong learning problems or intellectual disabilities. Seizures or problems with involuntary movements can also occur in some children. Despite treatment, children with PA have often more infections than usual. These need to be treated promptly to avoid metabolic crisis.
Hi, I'm Kristen,
I'm going to be telling you guys a little bit about the medical nutrition therapy related to treating this disease. So the number one thing you want to do is restrict the offending amino acids, methionine, threonine, isoleucine, and valine, in order to reduce the elevated concentrations of toxic organic acids that build up in the blood. Fasting should be avoided due to the catabolism of muscle, which leads to an elevation of organic acids in the blood as well. Individuals with this disease should consume a high energy diet that is limited in protein, especially protein that includes valine, which is the number one offending amino acid found in natural foods. So supplements that are medicinally created that do not have any of those amino acids I stated before are good things to use to supplement your diet. The diet should apply additional carbohydrate and fat intakes to support the energy needs, and the exact amount of amino acids a patient would be allotted depends on their age, disease severity, biochemical data, as well as growth and nutritional status. The diet should be sufficient in all micronutrients, vitamins, and minerals, and generally at least once in their life these patients have to go on tube feeding because they're unable to meet their specific needs by mouth. So how to calculate a diet prescription is you're first going to calculate the calorie and protein needs, and then you're going to determine how much protein can come from natural sources based on how many of those amino acids they're allotted. And this depends on the severity of the disease, so some individuals just have to count grams of protein, and others have to specifically look into the amounts of those amino acids in the foods. Frequent feedings are recommended for these individuals due to intolerance of fasting, and sick day diets are an important thing to implement because of the breakdown that occurs metabolically when you're sick. So this would include reducing your dietary natural protein intake by half or even eliminating it altogether based on the severity of the sickness. Nutritional monitoring and evaluation is often difficult in this disease because there is no value that gives a risk of decomposition. It's kind of if you have the symptoms, you treat them. There's no necessarily precursor to see how you're doing on that. So things you'd want to monitor are the nutritional deficiencies, just to make sure that you're getting adequate supply of all those vitamins and minerals. And you're also going to want to measure biochemical markers such as plasma ammonia, blood gases, lactate, and glucose, for example, just to make sure you're getting adequate energy and nutrients. Also, to end, a regular amino acid analysis is important to determine if your protein intake should be adjusted based on your disease state. Thank you.